Joining me now is the person who was co-chair of the Blood Inquiry report. Professor Katharina Hauck is Deputy Director of the Jameel Institute for Disease and Emergency Analytics. And as I said, she was co-chair of the Blood Inquiry. Katharina, thank you so much for joining me. Of course, this week it was announced that the headline that the newspapers took were some people could get £2 million. I think in the interim, people are to be awarded £210,000. But the more one reads about this scandal, the more awful, when you hear some of the individual stories, the more awful it is.
Yes, absolutely. It's I think as an academic being instructed by Sir Brian Langstaff to study the health and economic impacts of the infected blood inquiry, it was really one of the most difficult, I think, both academically and emotionally topics for me and for my colleagues to work on. And really our heart goes out to all that were affected. So I played really just a very small role in that inquiry. I was a co-convener for one of the reports that were submitted to the inquiry, or that were commissioned by the inquiry, in order to understand what went on. So there were colleagues working on clinical aspects, on aspects of medical ethics, on the psychosocial impacts of the infection. And of course, this inquiry went on for many, many years in order to get to the bottom of what had happened. And we have heard now the final report finally published by Sir Brian Langstaff, and I'm sure that was great comfort for all the families and those affected by that tragedy.
How can it must be very difficult to put a price on the quality of life, the illnesses and the early deaths, as you said, that psychosocial health and caring costs, because there would have been a lot of people paying for carers all these years, and then having financial difficulties at home. I mean, how do you go about quantifying how much people should be paid and who gets paid?
Yes, so I mean, of course, the question of how high the compensation should be is a legal question that we, as the economics group, are not qualified to answer. But what our role was, we tried to estimate really the lives that were not lived to their full potential, or the lives that were cut short. So we, what we estimated was that the costs to the individual in terms of lost health in the aggregate, so for all individuals that were affected, ranged between 70,000 and 200,000 lost life years. So just as a comparison, in Netherlands, COVID costs 60,000 life years. So over the 50 years that this scandal has been going on, a lot of lives were lost due to early death, but also due to terrible ill health. We also calculated.
Sorry, go on. I was going to say, because we forget it's not just the ill health. It's that you might lose your job, then you can't pay your mortgage, you can't pay your bills, then your lovely. It goes all the way through, doesn't it?
Yes, indeed. And we could only really capture some of these. We tried to capture the lost earnings due to individuals being too sick to work or work productively, or having to stop before retirement age. And these costs are enormous indeed. I mean, for the around 30,000 people affected, we estimated that they could be as high as 2.6 billion. And the last part of our analysis was indeed the costs to the cost due to health and social care that was carried both by the NHS, but also by the affected individuals themselves and their families who cared for them and could not go to work. And we estimated that these costs were between 900 million and 1.6 billion over the 50 years. So this is kind of the estimates that we generated to the inquiry. But as you said, it was very difficult to get a handle on the numbers and aggregate all these costs up, because records were destroyed, and it wasn't clear and isn't clear until the present day actually how many people are affected by that.
Gosh, yeah, as you say, records were as I said in the introduction, records were destroyed. So and the inquiry showed that there had been a deliberate cover-up. So for all of those people, having that money back is, many of them say, from a human point of view, and I'm sure sitting and you heard all the stories. I mean, I've only touched upon some of them. Often what people need, well, they can't move on if they're living with that, but it's just to hear sorry, just to have, and people say, we're sorry, we knew it, just to admit what they did, because for many, many years, these people were, as I said, going back to Margaret Thatcher, being told, oh, you're being silly, you got the best care. And that's the worst thing when you're suffering, to be dismissed as being mad or bad or sad or anything else, isn't it?
Yes, so I mean, I talked to some of the affected individuals over the years, working on this, and I think for them it was terrible to being told, or you received the best care that there was, when this was clearly not true. And um, it's difficult to understand why the UK didn't hold such an inquiry earlier. I mean, in other countries, these blood scandals happened as well, and the inquiries happened in the 1990s. So why did the victims have to wait so long?